Okay, can you see the PowerPoint?
Yes.
Yes. Okay. Okay, this keeps popping up. What I want to see is this. Okay. All right, so just a practice run. This is neonatal hypothermia. I'm Amanda Watson, and this is Wendy Woods McMahon from NM 705. Okay, so we have a clinical scenario. We have a Gravida 2 Para 1, 38 weeks, 2 days. She was afebrile in labor with reassuring fetal status. She had a spontaneous rupture of membranes with clear fluid 10 minutes before a spontaneous vaginal delivery of a baby girl at 5:01 a.m. The cord was allowed 60 seconds of exchange before clamping, cutting, and placing the baby on mom's chest. APGARs at 1 minute were 9 out of 10 with 1 point off for acrocyanosis. So what changes happen in the baby after birth that stimulate thermogenesis? Immediately after birth, with the expulsion of the baby from the warm intrauterine environment to the cold extrauterine air, the baby's temperature falls. This triggers a cold response, which sets metabolic processes in motion, oxidation of stored lipids, and generation of heat. The amount of heat production is largely related to the temperature of the skin. Cold receptors in the skin, spinal cord, hypothalamic thermal receptors, and a surge of catecholamines after birth activate the sympathetic nervous system, beginning the process of non-shivering thermogenesis, or NST. The occlusion of the umbilical cord decreases prostaglandins and adenosine, placental hormones, which suppress NST while in utero. This triggers an increase in uncoupling protein and rapidly increases brown adipose tissue metabolism and a surge in thyroid function. The moist body surface, evaporative and convective losses through respiration, large surface area in relation to body mass, and increased skin permeability, limited subcutaneous fat, and the inability to generate heat via shivering, and small curvature radius on the surface of the body all contribute to heat loss in the newborn. The newborn is dried using pre-warm towels on the mother's chest. 2 minutes later, the baby is taken to the scale located next to the open door with a light breeze and weighed without a pre-warm towel beneath the body. The baby is then replaced on the mother's chest with a fresh towel at room temperature and left to bond. What is wrong with this picture? We have the baby being weighed on a cold scale, not directly placed skin to skin. There's a towel between the baby and the mother's skin. This is actually a typo because we have a fresh room temperature towel wrapped around the body of the newborn. However, a room temperature towel is still going to cool the baby's temperature as opposed to a pre-warmed towel. And there's no hat placed on the newborn's head. So there's a large surface area on a wet newborn head that can lose and also gain heat under radiation. So heat transfer and loss. The transfer of heat within the body to the surface, relying primarily on blood flow and the capillary network, is called the internal gradient. Conduction efficiency relies on subcutaneous insulation and convective movement of heat through the blood. Sympathetic nervous system controls vasodilation and vasoconstriction to conserve and eliminate heat. The external gradient is the transfer of heat from the body surface to the environment. Conduction, convection, radiation, and evaporation all contribute to loss of exposed surface area. Okay, I didn't write this correctly. all contribute to the loss of heat due to exposed surface area. Evaporation, I have to write notes on.
Okay.
Conduction, how am I doing so far? Okay, I keep hearing an echo, and I have these big headphones on, and they're really weird to talk into. I feel like I'm in like a bubble or something.
Are you hearing an echo of you or me?
Of me.
Okay. I was hearing an echo of you earlier, but I had the our old conversation going. And I exited out that box and it helped.
Okay.
But I don't know if that's the case on your end.
I think part of it is, are you wearing headphones?
Yes.
Oh, you are? Okay. Because I can still hear the echo every once in a while. But like right now it's gone, but just a couple sentences ago I could hear it.
Okay.
Okay, I'm going to keep on going.
Okay.
Conduction involves the transfer of heat from the core of the body to the surface through body tissue and from body surfaces to objects in contact with the body, such as mattresses, clothing, or scales. The rate of heat transferred is directly proportional to the size of the temperature gradient and is minimized through insulation, blankets, clothing, skin-to-skin contact. Heat transfer is increased by placing babies on conductive surfaces such as metal. Room temperature mattresses and blankets can contribute to significant losses, especially in preterm infants. Conduction can also be a source of overheating and burns from objects such as heating pads. Heat can also be conducted to the surrounding air. Convection is the dissipation of heat from the interior of the body through the blood to the surface of the skin, carried away by moving particles in the air. Heat transfer depends on the velocity of the airflow, relative humidity, and air temperature, with higher losses at higher airflow velocities, while high air temp and low velocity reduces heat loss. Respirations are a source of convective heat loss through inspired cool air, replacing warm CO2 inside the lungs, which lowers the body temp. It is important to remember this when involved in resuscitation, especially with preterm infants. Heat can also be gained by convection in high air temp settings. Reduction of heat loss by convection can be achieved with swaddling and warm caps, polyethylene bags and wraps with very low birth weight infants, warm oxygen placement away from drafts and vents. Forced convection, which is a mass of moving air, happens with open doorways, fans, and high velocity O2 flow around the face. Sensitive thermal receptors in the face require warm thermal O2. Otherwise, warmth below the neck doesn't okay, this isn't written right. Sensitive thermal receptors in the face require warm thermal O2. Even if the baby is warm below the neck, if the face senses cold, this will trigger NST thermoregulation. If the infant's face is warmer than the body, then apnea can result. Then radiance, I need to write something on. Additionally, newborns can dissipate heat through vasodilation and sweat stimulated by the sympathetic nervous system. When core temperatures rise above 99.1 or 37.3 Celsius, although newborns are less effective at sweating than adults, sweat increases evaporative losses. Heat production must equal heat loss over a period of time. Newborns are capable of increasing their metabolic rate by 200 to 300%, but the major limitation is a narrow control range in their thermal environment. Energy is created through oxidative metabolism of glucose and fats, which requires increased oxygen consumption. Amount of metabolic heat produced varies with activity, feeding, sleeping, activity state, health status, and environment. The greatest amount of metabolic energy consumption is the brain, the heart, and the liver. The heat loss cascade quickly leads to hypoglycemia, hypoxia, acidosis, and respiratory distress. Clinical symptoms are low core temperature, cold skin, pallor, pale skin, hypotonia, lethargy or irritability, poor feeding or vomiting, tachypnea, and tachycardia. It's important to always evaluate for hypoglycemia and remember that rewarming takes several hours and rapid warming may lead to apnea. Back to our clinical scenario. 15 minutes after birth, the vitals are 97.5 degrees Fahrenheit, axillary, heart rate 164, respiration 68. The skin is cool to the touch and the baby is restless. What is going on with this baby? So the World Health Organization defines core temperature less than 36.5 degrees Celsius or 97.7 degrees Fahrenheit as hypothermia. We have the initiation of cold stress in this newborn, characterized by the tachycardia, the tachypnea, the skin being cool to the touch, and noticing that the baby is beginning to be restless. So thermoregulation, basal heat production is achieved through metabolic processes in cold stress. The heat above basal needs can be generated by physical or chemical mechanisms. Physical mechanisms for heat generation include involuntary shivering and voluntary muscle activity. Involuntary shivering is a late event in the neonate and is associated with spinal cord cooling after prolonged cold exposure. The spinal cord is protected by NST, or non-shivering thermogenesis heat production, through the brown adipose tissue stores, or BAT stores, around the intrascapular area. If the NST is blocked or is unable to generate adequate heat, then the spinal cord will begin to cool. Voluntary muscle activity or restlessness is characterized by restlessness, hyperactivity, crying, and this is as the muscles break down glycogen and glucose oxidation. Decreased, you can see that this physical mechanism can be decreased through the use of anesthetics, muscle relaxants, sedatives, tight restraints, and from brain injury. You may also see babies conserving heat through posture, specifically flexion. Non-shivering thermogenesis is the utilization of brown fat for heat production. Brown fat contains more lipids, mitochondria, and capillaries than white adipose tissue. It is a non-renewable resource of the newborn and is very low in low birth weight preterm and extremely low birth weight babies. It's located in the upper spine, clavicle, sternum, kidneys, and major blood vessels. The amount of BAT stores are dependent on gestational age. They are sparse in IUGR and low birth weight in preterm infants. The glycogen and glucose mediate brown fat cells to convert small intracellular fat vacuoles into heat energy. It warms the blood, ensuring stable temperature for biochemical reactions. It has high caloric demands, and it can lead to hypoglycemia very quickly. If there are any thyroid issues and hypothermia, then the brown fat stores will not be used effectively. So NST is triggered when the mean skin temperature falls between 35 degrees Celsius to 36 degrees Celsius. This is 95 to 96.8 degrees Fahrenheit. And this is the skin temperature. This is not necessarily the core temperature. This will increase the metabolic rate and can cascade in immature and compromised neonates, creating increased O2 consumption. Okay, this is where my notes get really funny, so I apologize. Let me see if I can just talk about it by looking at it, and then I'll go back to my notes and rework them later. So the process of NST is we have cold receptors in the skin. Some of the most active ones are in the trigeminal area of the face. And the cold receptors in the skin activate UCP1, which is uncoupling protein. And this then triggers the hypothalamus and the thermal receptors in the hypothalamus to trigger the sympathetic nervous system and to release norepinephrine, which activates the metabolism of the brown adipose tissue. This also includes catecholamine release and is involved with a thyroid hormone surge as well. Hold on just a second. All right, Wendy, this is where I'm losing it. Sorry. All right, I'm going to have to move on from this slide for right now because I have to like rewrite some of these notes. Is that okay with you? Are you still with me?
Yeah, sorry, I muted myself. I forgot.
Oh, okay.
Was the echo better?
The echo was way better.
Okay, my headphones, I thought my headphones were plugged in, but they really weren't.
Oh, that's why. That makes sense.
Yeah, and I couldn't get them to plug in, so I had to use a different pair of headphones. So I'm going to have my son fiddle with them tonight. But
okay. All right, that's no big deal.
Yeah.
So I have notes written on all of this, but they're like, I need to like put them into words that I can follow. So I'm going to have to like really work on this slide. So I apologize because there's information all over the place. So yeah, with the very low birth weight and the extremely low birth weight, we have less brown adipose tissue stores. We have decreased UCP1. We have decreased thyroid hormones. We have a larger surface to body mass ratio, decreased subcutaneous fat, smaller curvature radius on the surface of the body, and high transepidermal water losses. So these are all contributing factors to make the very low birth weight and the extremely low birth weight babies even more susceptible to cold stress. So the best thing that can be done is to prevent cold stress from happening in the first place. So low body temperatures are inversely related to survival, rates of survival. And coping mechanisms with cold stress can influence physiologic changes that alter the health status for very low birth weight and extremely low birth weight babies. So oxygen consumption is very low in thermal neutral environments. So what this means is that the range of ambient temperatures allow the body temperature to remain normal and the metabolic rate to remain normal without stimulating NST. This would be when the infant is asleep or at rest. They do not need to increase their heat production above resting levels to maintain a body temperature. So the way that we do this is we pre-warm our resuscitation area. This includes the birth room. It should be at a temperature of 75 degrees Fahrenheit. And this needs to be elevated if we're expecting a preterm or a baby with IUGR, for example. Pre-warming blankets and hats, gently drying the newborn immediately after birth, and replacing wet blankets with dry blankets immediately. We do not want to evaluate the newborn on wet blankets or towels or cool surfaces. We want to postpone the bath for at least 2 hours after having a stable temperature. So this does not mean 2 hours after birth, but 2 hours after the temp being stable. And we want to make sure that newborn care is done away from doors and windows, and that the head is covered and the body is wrapped for 48 hours. And I'm going to pass it off to you.
You'll still have to click. I can't do that.
Oh, okay. Sorry.
That's okay. Skin to skin the right way. Clinical scenario is the term newborn is dried and covered with fresh warm blankets. Newborn is then placed in an upright position, skin to skin between mom's breasts, wearing only a diaper and a hat with no material between newborn and mom's skin. Newborn rechecked 15 minutes after being placed with mother. Improvement noted with newborn's temp increasing to 98 degrees Fahrenheit auxiliary, heart rate 150, and respiratory 48. What makes this image the correct way for skin to skin? The newborn was laid directly on mom's skin without a towel or blanket between them. Dry, non-damp blanket around sides and back of infant forming a pouch, which provides insulation, reducing non-evaporative losses and possibly evaporative losses. And newborn has a hat on head. Skin-to-skin advantages eradicates possible heat loss via conduction, provides optimal thermoregulation, has the ability for early initiation of breastfeeding. Disadvantages include medical condition of mom, such as fatigue, pain, she's groggy after pain medications, or emotional state can also play a role. Having feelings of depression, or if the newborn was preterm, mom may have feelings of fear, shame, guilt, anxiety.
Oop. Were you ready for that?
No.
Okay, sorry.
That's okay. Medical conditions of newborn, such as being preterm or parental fear of dislocating IVs or other tubing. There can be a lack of social support, difficulties with access, including a lack of transportation and or living far from the hospital, a lack of private rooms or space for the mom or father within the hospital, and the inability to stay with the newborn at the hospital. Parental and familial adherence to traditional newborn practices can also play a part, and time restrictions, such as other responsibilities at work or needing to commute. Okay. Hats, clothing, and blankets have advantages being useful, especially immediately after a bath and immediately after birth or after a bath. Hats and clothes. The head accounts for 1/5 of the total body surface in a newborn, with brain heat production accounting for 55% of this metabolic loss. The advantages to using hats is that they're useful. Oh, I think I repeated that. Okay, I need to fix this. Sorry.
That's okay. This is why we're doing this now.
Swaddling and nesting help decrease evaporated losses by reducing the amount of exposed surface and by changing airflow patterns and skin emissivity. Advantages of swaddling and nesting include it maintains flexion. Swaddled infants in servo-controlled double-walled incubators have higher abdominal skin temperatures and require lower incubator temperatures. Swaddling also nested infants may have close approximation of skin to skin and rectal temperatures. I might just take that out. Some disadvantages for for hats and clothing and swaddling and nestings is that they are not appropriate for radiant warmers. They are less effective in thermoneutral environments or with the use of infants in servo control. Clothing and blankets alter thermal environment by both widening and lowering neutral thermal range. And it also depends on the type of material used. Stockinette hats are poor insulators and ineffective in reducing heat loss, while wool and insulated hats are best. Okay. You can go to the next one.
Milo's medicine, just so you know.
Okay.
Is that our kid?
No.
Radiant warmers help maintain temperature by using radiant heat that is produced in infrared spectrum and penetrates below the infant's skin. Advantages is that they are convenient to use and still allow direct access to the infant. It decreases radiant losses and eliminates temperature fluctuations. Some disadvantages include evaporated losses, insensible water loss, and the optimal skin temperature of the infant varies from infant to infant. Convective incubators are a double-walled system with walls that are warmed by a layer of warm water or computer-controlled electric.
Oh, I'm sorry. I interrupted you.
That's okay. Air from the outside is filtered and warmed prior to entering incubator. Some advantages include decreases in heat loss and radiant losses, reduces oxygen consumption by the newborn. Disadvantages, there's temperature fluctuations when opening and closing portholes or the hood. If portholes are opened, the temperature of the air inside the incubator falls rapidly and recovers slowly. This occurs less in double-walled incubators due to the inner wall acting as a heat reservoir. Radiant heat losses also occur. These account for 60 to 70% of total loss in the newborns being cared for this way. The plexiglass is opaque to radiant waves, and infants' radiant body heat in the inner side of incubator wall.
Like Clorox or something? I don't know.
Further alterations in radiant heat loss
It'd be up to you if you wanted to.
also occur due to infants being clothed, the incubator being covered with a blanket, or being placed near a window or exterior wall. Polyethylene wraps and bags. These wraps enhance radiant heat gain and creates a microenvironment under the wrap. This is recommended for preterm infants to reduce heat loss after birth and in the early days post-birth. Advantages include reducing evaporative losses, and disadvantages include unwrapping the infant needs to be minimized because it disrupts the microenvironment. Some medical and cultural considerations for healthcare providers is a lack of care education within the facility, no uniform protocols, including inconsistent practices and beliefs among staff, lack of adequate staffing levels, belief that it is unsafe after cesarean birth. Some nurses believe that the newborn is at risk for falling when a skin-to-skin position is done, and that the infant would be at an increased risk for hypothermia. There have also been assumptions made about patients' preferences based on cultural ethnicity and feelings of a lack of parental readiness and parental anxiety by staff. The healthcare facility also has some cultural considerations. There's a lack of financing and service delivery, lack of policy that sets standards for and expectations of skin care during the hospital stay, and lack of adequate staffing levels. Other cultural considerations. In India, lukewarm bathing and scraping of the vernix is done immediately after delivery. This is done because mothers have a concern that if the newborn is not bathed immediately, the neighbors and relatives will not approve. Bathing in cold water within 6 hours of birth occurs, and then wrapping the newborn in thin cotton cloth after birth. In Tanzania, newborns are bathed with cold water immediately after birth. With home births, it is believed that cleaning the infant will make them strong. During the cold bath, a warm water bath is done on the infant's head. This immediate bathing is not completed in the hospital. However, the newborn is bathed once at home. In Ghana, hot water is used only in the second bath where the newborn can be massaged. It is tradition that newborn's first bath is a cold water sponge bath. Hot water is also not immediately available. The water needs to be boiled, and this is often done after the first bath. Newborns are bathed immediately after delivery in the hospital setting. It has been said by a mother that newborns are bathed immediately after delivery in the hospital setting, so there's no reason to delay birth bathing in other settings. In Mexico,
Can I interject real quick?
Please.
Can you hear? Okay.
Yeah.
I think you could also in this slide maybe say something about just low resource environments, because I came across that in some of the reading. So maybe just pointing out that in some like low resource environments, the only form of rewarming might only be skin to skin, and that there may be a lack of education.
Okay.
You know what I mean? Because there might not be warmers, or there might not be hot water. So I just came across some of that in reading somewhere, but I don't remember.
Okay.
Okay, go ahead. Sorry.
No, you're fine. I'm writing that down. Okay. In Mexico, babies of all ages are considered to have frío, which is cold. It is believed that getting a cold will lead to sickness, so newborns and children are often dressed in extra layers in order to avoid getting sick. Okay.
Oh, that's it.
References. Yeah, that was it.
All right, cool. So let's see where we're at with time.
We went over, but we kind of stopped and chatted a little bit.
Okay.
We actually started the thing at like 9:50. I forgot to write down the time I started talking.
Okay, hold on.
I mean, 9:19 is when we actually started, is what I wrote down when you started reading the title slide. And so then now, so that's all Eastern time, I should say, though, too.